What if you had a device that could just silence chronic pain? For a whole lot of people, that's not science fiction. It's a real technology called spinal cord stimulation. But there's a pretty big catch. For a surprisingly high number of people, these incredible pain pacemakers eventually have to be taken out. So today, we're going to dive into a major scientific review to figure out why.
To really get why this is such a big deal, we got to look at the numbers. We're not talking about some rare condition here. About 1 in every 10 people on the entire planet deals with something called neuropathic pain. That is a huge number of people living with pain that can get just impossible to treat.
So you have this massive, widespread problem of pain that often doesn't respond to anything else. And to tackle it, medicine got really, really innovative.
It's called spinal cord stimulation, or SCS for short. And you can pretty much think of it like a pacemaker, but for pain. It sends these gentle electrical pulses right to the spinal cord, and that basically scrambles the pain signals before they ever reach your brain. And, the results can be absolutely incredible. Study after study shows that for the right person, SCS can slash their pain and give them their life back.
And look, for the people it works for, this isn't just some minor tweak. It can be the only thing that works when everything else has failed. It lets them get back to work, to their families, to just living. It really represents a ton of hope.
And that brings us to the big central puzzle here. If this technology is so great, why are so many of them, we're talking up to 38%, eventually taken out? This procedure is called an explant, and it's a huge setback. It basically means the therapy failed. So, what is going on?
Well, to find some answers, a team of researchers did a massive deep dive. They started with over 1,200 different studies and painstakingly filtered them all the way down to the 21 most important ones. So what we're about to look at is the result of some seriously impressive scientific detective work.
So the researchers really set out to get to the bottom of what they call the explant problem. They wanted to pinpoint the specific risk factors that could help predict whether a patient's device would end up needing to be removed.
Now, on the surface, the reasons for removal seem pretty straightforward, right? It's not giving enough pain relief, maybe there's an infection, or there's a problem with the actual hardware. But see, those are just the symptoms. The real question is, what are the underlying things that make these problems more likely to happen in the first place?
First, let's take a look at the hardware. The review found that the technology itself can actually be a pretty big risk factor. Yeah, it turns out not all these devices are created equal. The research has found that older generation models, and also ones with those conventional rechargeable batteries, had a higher risk of being taken out. And get this, the way the device is put in matters too. The less invasive procedures actually had higher removal rates. And if a patient needed a second surgery to fix something early on, well, that was a really strong sign it wasn't going to work out long term. But the hardware is only one piece of this puzzle. The review discovered that factors related to the patient, the whole human element, were just as important, and maybe even more so.
The data on this was really, really clear. A history of conditions like depression or anxiety was linked to a much higher risk of the device being removed. Now, this isn't about placing blame, it's about biology. These conditions can literally change how our brains process pain signals. In fact, one analysis found a direct link. The more psychiatric conditions a patient had, the higher their odds of removal.
Medication and substance use before the implant also played a huge role. Multiple studies connected high-dose opioid use, we're talking the equivalent of over 40 to 90 milligrams of morphine a day, to higher explant weights. And it was the same story for the use of benzodiazepines, tobacco, and other substances like cannabis or cocaine.
And when you look at the numbers, they are really striking. Just look at tobacco use. That was linked to up to a 6.5 times higher risk of removal. And the effects of high-dose opioids, depression, and cannabis use were also really significant. These things are powerful predictors.
Okay, but this is where things get really fascinating. You think that basic stuff like age and sex would be clear predictors, right? Well, the science is all over the map. Some studies found younger patients were at higher risk, others found the exact opposite. Same thing for sex. It's just a powerful reminder that chronic pain is unbelievably complex, and there are no simple answers here.
Okay, so that's a whole lot of risk factors, I know. But what about the other side of the coin? The good news is the review also found factors that are protective, things that are linked with a lower chance of the device having to come out.
So what helps? Well, having a normal BMI was a big one. And remember how untreated psychiatric conditions were a risk? Well, it turns out that patients who are actually being treated for these conditions had lower explant rates. That really suggests that managing a person's whole health is crucial. The specific type of pain matters too. Conditions like radiculopathy, which is that nerve pain that shoots down your leg, seem to do really well. And interestingly, the doctor's experience played a role with this kind of sweet spot for those who did a medium number of these procedures a year.
So, when you sift through all this data, the hardware, the patients, the providers, what's the single biggest lesson here?
The researchers really say it best themselves. Patient selection is crucial. It's not just about having this amazing piece of technology. It's about figuring out exactly the right person who is going to get the most benefit from it. So in the end, the success of a Painmaker for pain isn't about just one thing. It's this really complex interplay between the device itself, the patient's unique health story, and the specific nature of their pain. And understanding this whole web is really the key to getting better results.
Which leaves us with a final question to think about. As all this tech gets better and better, maybe the next huge leap forward in treating chronic pain won't be a new kind of device at all, but a much smarter, data-driven way of making sure these powerful tools get to the exact people they are most likely to help.